Oh, okay, so the next topic is going to be the acromioclavicular joint dislocation. So
Okay.
okay, so for the AC joint dislocation is defined as the sprain or tear of the acromioclavicular joint or the coracoclavicular ligaments. So this injury is found in up to 9% of all like shoulder girdle injuries in athletes. So we should start with the anatomy of the AC joint dislocation. So in this case, for the static stabilizers, we are divided into the AC joint ligaments and the coracoclavicular joint ligaments. So for the AC joint ligaments, as a static stabilizers, we have the superior, inferior, and posterior ligaments. And for the CC joint, we have the conoid and trapezoid ligaments, as seen in the picture. And for the dynamic stabilizers, we have anterior deltoid and trapezius. And for the bony component, we have a dithyroidal joint and fibrocartilaginous intra-articular disc.
So the AC joint is very small joint, right? Why is important?
Because I think it's because it's sometimes misdiagnosed because people tend to think that it's shoulder dislocation.
Mm-hmm.
And it has like many of the presenting symptoms are quite similar.
Mm-hmm. So in the past, we call this pseudo dislocation, right? You can see deformities at the shoulder. So people in that time, there's no X-ray. They thought that this is a shoulder dislocation. Okay. So you didn't answer my question. Why it's important?
Oh, because it like you treat it differently from shoulder dislocation. So management, like it differs in terms of management.
Yeah. So if you didn't treat it, is it okay for the AC joint?
For AC joint, like it should be divided by like the Rockwood classification for severity, and then we can treat it like according to the severity.
Mm-hmm. So what is the importance of the AC joint? So what, is
Like,
it important? It's just a small joint.
Oh, it controls a lot of shoulder like
it helps stabilize the scapula.
So what I'm asking you?
It helps stabilizes the scapula. Is it?
So the AC joint connecting the clavicle, okay, to the whole scapula and the arm. So you're thinking like the clavicle is like the hanger. So everything hanging on this, okay? So if the AC joint dislocate, the ligament is torn. So the whole shoulder complex will drop down. เหมือนไม้แขวนเสื้อนะ แล้วก็ shoulder complex proximal humerus scapula is hanging. So when it's dropped down, the problem is that the patient will have scapulothoracic problem. You understand? Okay. The scapula will drop down, so they will have problem of the articulation between the scapula and the thoracic. Okay. So the patient may have wing scapula. After that, the patient may have the scapular dyskinesia. Okay, after that. So that's why it's important. Okay. Actually, the AC joint have very little motion. Its function is to connect, just to connect the clavicle to the whole shoulder complex. Okay. Very good. Next.
So for the next part, we'll be talking about mechanism. In terms of AC joint dislocation, the most common mechanism of injury is by direct force to the acromion with the shoulder abducted, usually as a result of like falling over.
Mm-hmm.
So in this case, it will cause the acromion to move inferiorly and medially, while the clavicle stays in place by the sternoclavicular joint ligaments. So this usually what causes the AC or the CC ligaments to tear or injury. And in contrast, indirect injury is considered very rare in AC joint dislocation, but it can still happen if like the patient falls onto an outstretched hand or arm with superiorly directed force.
So most common mechanism is the first picture. So what kind of accident, what kind of sports, Veechayut? Then we have this injury, falling on the top of the shoulder. So the clavicle is not floating. Clavicle is not floating, but the whole scapula was pushing down. Okay? Understand? It was pushed down, so relatively the clavicle looked like superior migration. But actually the whole shoulder complex is dropping down. Okay? What kind of accident, very common.
Is it like pole vaulting?
In my practice, the most common accident is biking. Yeah, professional biking, they will fall in this position because the foot pedal will be fixed to the foot, right? And when the patient fell down from biking, they're always going down like this. Also, surf skate, right? Skateboard, right? The patient fall down like this on the top of the shoulder. Yeah, that's very common. Outstretch is less common, but the very common is the first mechanism. Okay, next.
So for the signs and symptoms, most commonly the patient would come with pain at the AC joint, sometimes with referred pain to the trapezius. So as you can see in the picture, like the patient sometimes present with abnormal contour of the AC joint. And then there's special, besides from like regular shoulder physical examinations, there's special tests including O'Brien's test, cross-body abduction, and a series of tests called the AC joint provocation cluster test. So for the next slide, it will be like the videos.
So the cross-body adduction will be very obvious deformities, right?
Yeah.
Okay, this is for the O'Brien test for the AC joint pain.
So there's like two actions in the O'Brien test. The first, you should try to like pronate the arm as much as possible in a flexed shoulder position, and then try to apply force on top. And if the patient has pain, but then you can try the second one where you supinate the arm, and if there's less pain, then it's a positive like finding, indication of a superior labrum from anterior to posterior lesion.
How many years ago this video?
14 ครับ
14 years ago. My God. Okay, thank you.
The next one, this is the cross-body abduction test, and it's this one is to measure the integrity of the AC joint, and this is the one where it's most commonly that you can see the abnormal contour, and the patient will have lots of pain when you abduct their arm.
So these two tests is for the AC joint arthritis mainly. AC joint arthritis, okay? The cross-body adduction and also the O'Brien test. Okay? Okay, next.
This is like AC joint provocation cluster test. So basically, this is where we test like the shoulder range of motion, and we can see the abnormal contour and the pain that the patient has. So it's a series basically set to evaluate the AC joint instability.
Yeah, this test you stabilize the shoulder, the clavicle, right? And on the other hand, you stabilize the scapula, and then you move. Okay, so when you move, you can feel like the clavicle and the acromion can move separately, right? So that means all the ligament is torn, AC and CBC ligament, right? And it has painful range of motion.
So as seen in the previous video, there's mainly like two types of instability of the AC joint, including vertical translation and horizontal, depending on the ligament of that is injured.
Mhm.
So next we're going to talk about investigation, which is film of the AC joint, and most commonly we will send bilateral AP of the AC joint view, Zanka view, axillary lateral view, Basmia view, which is also known as cross-body adduction view or weighted stress view. But to my understanding, like weighted stress view it causes the patient lots of pain and is not commonly done.
Mhm.
On the next slide, we can see the Zanka view is like viewing the AC joint at a cephalic tilt degree, and you can see there could be potential like
Your sound is not clear. What's wrong? So the Sanka view is like true AP view of the clavicle of the AC joint. You separate tilt about 10 degrees. Okay. So Sanka is cephalad. But caudal tilt view is caudal, right? Rockwood view is going down. Sanka is going up. Okay. Don't mix up.
to my understanding, you can like measure the AC joint. And
Hey, your sound have some problem, Veechayut. What's wrong?
I don't know.
Previously it's good.
Can you hear me now?
Yeah, okay.
Oh, okay. Like to my understanding, you can measure the AC joint, and if it's usually less than 5 millimeters, and if it's more, you can suspect AC ligament injury. And like you use like the different views to confirm the measurement and the view.
Okay. Because the displacement is three-dimensional, so in AP view, you can see the superior inferior displacement. For the axillary view, you can see the anterior posterior displacement, right? Especially type 4, the clavicle you move to the back. Okay. So next.
It's called Basmia view, but also known as the cross-body adduction view.
Mm-hmm.
So in this view, you can like when you adduct your arm, it forces since the clavicle is like stabilized by the SC joint, it will like move superior when you abduct the arm.
So the AC joint will displace if the scapular protraction. So doing this way, you move the scapula forward, right? You know scapular protraction and retraction. This is scapular retraction. Back off. The AC joint will be reduced. Okay. When you lie, right? Protraction or adduction, the AC joint will dislocate. Okay. So you just doing the scapular retraction back of the AC joint will be reduced. But this test is like you're doing the scapular protraction and adduction. So the dislocate will be obvious. Okay. So that sometimes the patient come to see you at the emergency room and they put the sling on. When you do see the X-ray, it look very normal. Okay, so keep in mind you need to remove the arm sling and send the patient for X-ray. If the patient put the arm sling on and doing the scapular retraction, the AC joint will be reduced. Okay, and you can misdiagnose. Next.
So this is the Rockwood classification that you use to classify the injury of the AC joint dislocation,
Mhm.
and is basically summarized as like grade 1 being of the lowest severity and grade 6 being the most. So in grade 1, you can see that there's AC ligament
Normal.
stretched or sprain injury.
Just
in
tender
grade
at the AC joint. Okay.
and in the grade 2, there is a ligament with like partial tear of the AC joint and possibly sprain of the CC joint ligament.
Mhm.
Where in type 3 is usually both ligaments are torn, and in this
Yeah.
case, this is like grade 3 is usually the cutoff for the treatment, whether or not the patient can receive like conservative treatment or should
Yes.
undergo surgical treatment.
Mhm.
So
So grade 3 is complete torn both. Grade 1, 2 conservative, right? Grade 3 you have torn CC ligament and AC ligament. Okay. So you can see obviously the clavicle and the scap and the acromion completely separate. Okay. Grade 3 and grade 5 is the same, but the grade 5, the displacement will be more. Okay. Grade 6 is very rare. I never see grade 6 before, right? The clavicle is going down. Grade 4 is the clavicle moving to the back. Okay. So grade 3 is a cutoff point, right? You can treat the grade 3 conservative or surgery depending on the patient activities. But 4, 5, 6 need surgery. Okay, very good, Chayu.
So as said earlier, if it's like grade 1 or grade 2 or grade 3 with clavicle displacement less than 2 centimeters, we can conservatively treat them by having a arm sling immobilization and having like resting with ice, and rehabilitation is recommended in these patients, including early shoulder range of motion exercise to regain function. And in this case, the treatment duration usually lasts from 6 weeks to regain functions and normal activity in 12 weeks.
Mhm. We call this skillful neglected. Like you do nothing, just sling, okay? Salita, will you try to reduce the AC joint? Salita, even in grade 3. Will you try to reduce the AC joint? This arm sling can reduce the AC joint?
I think no.
Salita, yes or no?
I think no.
No? Why not?
It just immobilizes the joint.
Mhm.
Yeah.
Do you try to reduce the AC joint? You need to do that. It's like the shoulder dislocation, you need to reduce the joint, right? Hip dislocation, you need to reduce the joint, right? How about the AC joint? Sarita, you say no, right? No need.
I guess it's a no.
Hmm?
I'm not sure because it doesn't have movement.
Mm-hmm.
The function is just to connect the clavicle.
Mm-hmm.
So I think there's no need for reduction.
Yeah, you're right. In grade 1, 2, and 3, right? So we call this skillful neglected. Yeah. So even the patient have the not complete reduction, but the function is pretty good. Okay. But in grade 4, 5, 6, you need to do that. In grade 3, it depends if the patient have like very active overhead athletes, heavy worker, you need to reduce that. And if you try to reduce that by conservative, it's impossible. Okay, understand? You cannot reduce it because the AC joint is not like hip joint. You can traction or shoulder joint, you can traction and the head is reduced. But AC joint is impossible. Okay, if you want to reduce that, you need to do surgery. Okay, next.
So for the surgical treatment, the operation is called the coracoclavicular interval restoration. And as stated, like grades 4, 5, and 6 should be surgically managed, or in types 3 and depending on the patient, if they're athletes, laborers, or patients with chronic type 3 or conservative or failed conservative treatment, then they should have the surgical treatment. So another like note is the contraindication to treatment is patients with poor compliance to post-op rehabilitation or certain skin problems at the site.
Mhm.
And
So another indication for the surgery is the cosmetics, because some patient concerning about the prominence of the distal clavicle.
yes, and the surgical operations comes with complications, including residual pain of the AC joint, AC arthritis, possibly hardware failure or coracoid fracture.
Hmm.
And
Okay, very
that's
good.
it for AC joint.
The AC joint fixation is not simple. There's so many ways to treat the AC joint, okay, and a lot of failure. So that's why many surgeons they recommend not to touch the AC joint, okay, because if you try to reduce that, sometimes you put the implant in, implant can be broken because a lot of force. So this AC joint surgery is not easy, okay.